Good afternoon, dear students. After the long discussion of radiology of urinary system, today we'll discuss the clinical applications of MRI. As you know, MRI is one of the radiological investigations, and in some neurological diseases it may be the study of choice. Today we'll discuss the clinical application, and it will be in two parts. In the first part, we'll discuss somewhat the physics involved in the MRI, and we'll discuss how the MRI is done and how MRI is performed, and what are the various images which can be obtained by this very important radiological investigation. Now, what is MRI? It comprises of three things, as the name suggests: magnetic resonance imaging, the magnet, the radio frequency, and the imaging or archiving of the study. We are magnets, really? No, we are all made up of elements, and 92 elements occur naturally on Earth. Human body is built of only 26 elements: oxygen, hydrogen, carbon, nitrogen. Elements constitute 96% of the human body mass. Oxygen is 65% of the body mass. Carbon is 18.5%, hydrogen 9.5%, nitrogen 3.2%. And let us ignore all these elements but keep the hydrogen in discussion. Now you will ask the question, why hydrogen? The reason is simplest element with atomic number of 1 and atomic weight of 1. When in ionic state, that is H positive, it is nothing but a proton. Proton is not only positively charged but also has magnetic spin, which wobble around its axis. MRI utilizes this magnetic spin property of the protons of the hydrogen to elicit images. So we are all magnets. The next question is, but why we can't act like magnets? The answer is, the protons, for example hydrogen ions in the body, are spinning in a haphazard fashion and cancel all magnetism. That is our natural state. We need to discipline them first. And how? For that we need a big magnet from outside. Magnetic field strength, which is available for the clinical application, it ranges from 0.3 to 7 Tesla. Now, Tesla is 2500 times more than Earth's magnetic field. Average field strength is 1.5 Tesla. The magnetic power is measured in Teslas. Oh, there are various types of magnets: open magnet, less field strength, less claustrophobic; closed magnets, more field strength and most claustrophobic conditions. In this picture you will see how the protons get aligned. Compass aligns with the earth. In a similar fashion, our body protons, hydrogen, align with this external magnetic field. Now we are disciplined, spinning in line with each other And what will happen next? Now it is the time to listen to the radio frequency or resonance. As we have initially discussed that MRI comprises of magnet, resonance, resonance means radio frequency, and imaging means archiving. So when the protons are spinning with alignment in the presence of a large magnet, pushing a swing in time with natural interval of the swing will make the swing higher and higher. So we apply the radio frequency. Similarly, radio frequency pulses in the resonance push the aligned protons to a higher energy level. What is radio frequency pulse? Same as radio waves, high wavelength, low energy electromagnetic waves. Radio frequency coils, they are there to emit or transmit the radio frequency waves. They act both like transmitters and receivers. They have different names and different coils for the different part of the body to be imaged. Now, once the protons are at higher level due to the application of the radio frequency wave, when the radio frequency is turned off, the high energy gained by the protons is transmitted as NMR signal. The original magnetization begins to recover. The excessive spin begins to dephase because now there is no radio frequency. They try to align all the protons to the same initial condition in the presence of the large magnet. Now we retransmit the energy for imaging processing. The emitted energy is too small despite 2500 times the magnetic field with the resonance radio frequency pulse to convert them into images. Hence, repeated on-off of the radio frequency pulses are required. The emitted energy is stored in K-space, analyzed and converted into images. This physics seems to be quite hard to understand, but still very interesting phenomena. Now, what kind of images can be obtained with MRI? T1 weighted images, T2 weighted images, proton dense images, ADC, GE, gradient recall echoes, perfusion images, fMRI, bold images, MR angiography, MR venography, and of course post-gadolinium images when the study is performed after the intravenous contrast of gadolinium, which is MR contrast media. Volumetric images, MR arthrogram, FLAIR images, STAIR, and etc. 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 We have a long list of other images which can be deployed to see the tissue differences. Now this is one example of a T1 weighted image, axial image of the brain. The center shows a low intensity area bilaterally. These are the ventricles, and CSF appears black on T1 weighted image. On the right of the image is depiction of the gray matter CSF and white matter longitudinal magnetization. Now this is T2 weighted image, the total contrast opposite of the T1 weighted image. Here the CSF looks bright So this is the main difference between the T1 and T2 weighted images, where fluid looks dark or low intensity in T1 weighted image and bright or hyper intense on T2 weighted images. These are the basic phenomena which occurs in T1 and T2 weighted images. Now, how the tissues appear in various MR applications. The whole sketch shows T1 weighted image, fat appears black, water appears dark, muscle iso-intense, ligaments dark and bone dark. On proton dense images, which is actually midway between T1 and T2 weighted images, in which fat appears iso-intense, water iso-intense, muscle iso-intense, ligaments dark and bone again dark. Now we come to the T2 weighted image, in which fat appears iso-intense. Actually, iso-intense means iso-intense to the gray matter. For example, if we are taking the images of the brain, water will appear bright, and here there is mistake, it's written black, but it should be bright. Muscle iso-intense, ligaments dark and bone dark. A bit of sequence experience. This is T1 weighted images, coronal image of the brain. Here you can see the gray and white matter. You can see the frontal horn of the lateral ventricles, which appear black because this is a T1 weighted image. So the water or fluid will appear black, fat will appear bright, which is, you can see a bright circle or hyper intense over the scalp. T2 weighted image, reverse of the T1, hyper intense or bright CSF in the ventricles and the extraventricular CSF spaces. Gray-white matter distinction is also evident. Now this is FLAIR. Here you can see it's not very much different from the T1 weighted image. The CSF is still black, but it is usually performed to see the encephalomalacia or other conditions in the brain, to differentiate it from the CSF space, filled spaces, or a real myelomalicic changes. Now this is fat sat. Fat sat means fat saturation images. The scalp fat has been saturated and it appears very dark. So this is also performed in condition where you want to differentiate between a fluid filled structure or a fat structure like lipoma, etc. This is water density image as we discussed previously. There you can see the CSF iso-intense, and the dark structures are actually the pathological calcification in the brain substance. Now you can see there is a structure in the frontal region which shows peripheral hyperintense rim. Actually this is a glioma, and the contrast was given, and this is outlined by the presence of the contrast in the periphery of the structure, periphery of the tumor. MR Venogram, the venous system of the brain is outlined. 3D MR Venogram, you can see all the venous drainage of the scalp and the brain. MR Angiogram, You can see the vertebral arteries, the carotid arteries, the internal and external carotid arteries, the circle of Willis. The important thing here to note is that in MR angiography, we need not to give any contrast, but the presence of the blood in the vessels is exploited and the angiographic images are required. Lumbar spine, this is T1 weighted image. You can see the vertebral bodies, the intervertebral discs, and on the back of this is a bright or hyper intense thick layer. This is the fat layer on the back. You can see the spinal cord and CSF, which is dark. So this is T1 weighted image showing all the image quality which is present in the T1 weighted image. T2 weighted image, same patient, reverse, hyper intense or bright CSF. Fat is slightly iso intense, not as bright as it was in the T1 weighted image. Now this is a stair image. This is almost like fat saturation. You can see the fat is almost iso intense or gray. The patient underwent surgery and the arrow marked the area of laminectomy. Here you can see the missing of the spinous processes in the lower lumbar and lower lumbar region and sacral region. MR arthrogram, again we do not need to give any kind of contrast, but the presence of the fluid in the joint space is exploited. Sometimes interarticular gadolinium is given. Now we want to see physically how the MR is performed. This is a tight bore. For an example is given as the tunnel on the right of your screen. The patient has to undergo through this tunnel is like 5 to 6 feet and 2 to 3 feet wide. So this is why some patients feel claustrophobia. This is a closed bore, high power magnet. Now there is a checklist when a patient undergoes the MR examination or goes into the tunnel. He must have no mobile, no credit cards, known potential safety concern due to the large static magnetic field, internal cardiac pacemakers, steel cerebral aneurysm clips, ferromagnetic, small steel silver slivers embedded in the eye, life support equipment with magnetic steel, and cochlear implants, stents anywhere in the body. If they are ferromagnetic, they'll be pulled and any disaster may occur. Now, what happens in the MRI? Or in other words, we can say, how is the MR performed when the patient is inside the magnet? The patient had to still for 15 minutes to 45 minutes. Noise, noise, and noise. This is due to the presence of the gradients which get off and on, and they produce a lot of noise. Now they have invented other things which you can listen to the music in the darkness, so you do not bother about the gradient shout. and there are instructions, of course, another 5 minutes to go, or please stay still, things like that. And sometimes when the injection or contrast is required, then somebody will come and inject and the process will start again. Now we'll discuss some of the clinical aspects of the MRI. When to MRI? Where are conditions where we need to go for the MRI? When everything else fails, there is MRI. When you want to borrow time from the patient, request MRI and hope that the waiting time will take care of the patient. Advantages of MRI: no ionizing radiation and no short long-term effects demonstrated. Variable thickness, any plane, better contrast resolution and tissue discrimination. Various sequences to play with to characterize the abnormal tissue. Many details without IV contrast. As we said that in particularly in angiography, venography, we need not to give the contrast to the patient. So this is non-invasive. Some of the disadvantages: time consuming, not easily available, no on-call service, need to tweak sequences as per the clinical questions, hence cannot be generalized. Nothing is perfect in this world. MRI has limitations, for example bone, air, again time consuming, poor spatial resolution and expertise. And with this we'll come to the end of the part 1, and today's assignment is what MRI stands for, and the next question is which is the most abundant organ in our body. Thank you very much.